Greetings, CEG family. Thank you for inviting me to this amazing occasion and to join this incredible group of people who you should know. I'm Dázon Dixon Diallo. I'm founder and president of SisterLove Incorporated, and I'm the founder and president of SisterLove International in South Africa. My specialty, I think I would say I am, well, of course I'm a public health advocate, public health practitioner, but I think mostly I would say I'm a social entrepreneur. I'm an ideas maven, that's for sure, and a justice innovator. Yeah, we can talk about what that means in another conversation. What got me started in this work is it was an evolution. It was a series, a process that ended up with me being in the right place at the right time for the right reasons, I guess. What got me started in this work is I was already working in sexual and reproductive health and rights. I worked at a local women's health center, which also was an abortion clinic. I was still actually in college and was a part of the anti-apartheid movement on my college campus. And I was also exposed to the fierceness of advocating for Black women's health through the inaugural conference on Black women's health that was hosted by Billie Avery and so many other women that later formed the National Black Women's Health Project, of which I'm still a member today, known as the Black Women's Health Imperative. What got me started? The funny story on that is Rock Hudson. And, it's a weird way to start, but it's Rock Hudson because it was on that day that he announced his AIDS diagnosis to the world, was the day that the local AIDS service organization called my organization, because we worked with women, because now that Rock Hudson has it, all of these women were interested in what to do about HIV and AIDS. So they called us. I answered the phone at my organization. I was shocked and dismayed by what I was hearing from the other end. And another coworker and I immediately started volunteering with the AIDS Service Organization. Things evolved over time, and here I am. So, Rock Hudson. So what's interesting is because the work that we do at SisterLove and the work that I deeply believe in is that ending the HIV epidemic is a monumental shift in how we organize around human rights and securing human rights and social justice for everyone. So that means my work is extremely intersectional, right? And what I think needs to be accomplished in the field is that we end up delivering programs, services, care, education, support, all of the things we do in our communities, but that we end up doing it as intersectionally in the work and in the service delivery and in the research that shows up in the lives of the people with whom we are trying to keep and stay healthy, right? So people who have a lot of intersections going on in their lives in terms of all of the different conditions, experiences, the margins in which they are struggling just to survive, much less to thrive, even if they're living with a long life-impacting condition like HIV. If they're Black, if they're poor, if they're Southern, if they're female, or if they're trans, or if they're young, or if they're old, or if they're casual sex participants, or if they are engaging in different things, right? That, and not just engaging, but in their environment encompasses these different things, then the solutions to their challenges should be as intersectional as their challenges are in their own lives. That's what I think needs to be accomplished in our field. That means we're going to end up addressing stigma because we're going to deal with racism, and we're going to deal with sexism and homophobia and xenophobia. We're going to deal with gender-based violence and gender inequality and houselessness and nutrition and healthy living environments and establishments, and comprehensive sexual health education. And you name the challenges that make HIV more prevalent or harder to deal with in a given person's life. That's what we need to be accomplishing, is bringing all of that together. Working it together or creating it all in one space, it doesn't matter to me as long as that's what we're doing across the field. And so every year, because my dad was at the local university at the HBCU, the historically black college where he worked and was in my neighborhood. My mother was a public school teacher, teaching life science in the one school that was in the whole county. So they knew all the kids and they had access to them. And so my mom and my dad would organize with other folks, and they would collect money, they would raise money, they would know the lists of all the children, school children, young people in our communities who were in need of services, whether they were on free lunch programs or on Medicaid or getting welfare or living in public housing. Those are places where people were expressing needs. So they would go, we would come, use that money we raised, buy all of these gifts up here in Atlanta, because I'm from a small town about 100 miles south of here. We get all of these gifts appropriate to the ages and the genders of the children in hundreds of households in my hometown. And then we bring those gifts, we'd wrap them, we'd put them in the floor at the gymnasium on Christmas Eve and have all of the families who had children who were receiving these gifts. The cheerleaders and the majorettes from the university would come out and do the performance. And they would come out in these red and white felt cute short skirt outfits with the Santa hat with the little white bob on the end, the bunny rabbit tail on the end, all cute. They'd have on their white tights and their knee-high, patent leather, pleather, whatever, white heeled boots, right? And then they would dance and they would sing and they would perform just like the Rockettes. And then they got to give out the toys to all the families. They were called Santa-ettes. Santa would sit up there on the stage in the gymnasium, and the Santa-ettes would be there to give away the gifts. All I ever wanted to be when I grew up was a Santa-ette. Maybe I have. What's my favorite snack and why? My favorite snack, and could be a meal, is a tomato sandwich. Sliced tomatoes, mayo on some nice toast with some salt and pepper. Boom. The best ever. And why? Because whenever it was my dad's time to cook, my daddy didn't really like cooking, didn't know how to cook, but he can make a mean tomato sandwich, and that was our favorite thing together, even when my sister and brother weren't that interested, because they never really were. But when my daddy made those tomato sandwiches, that was one of the happiest moments in my life all the time. And I still make those tomato sandwiches to this day. And I still call my dad every now and then and ask him when he's had one. My hobby is radio and podcasting. I love producing and hosting and editing, listening, interviewing, getting deep involved into understanding and sharing people's stories, covering other people's productions. All that kind of stuff is stuff that I really love to do. It's my volunteer gig, and it's what I do in my off time. That and a little bit of DJing, making up some mixtapes and some playlists for people to enjoy, and making sure that music, which is my love language, shows up in all kinds of spaces. That's my hobby. And if I wanted people to help SisterLove, well, first and foremost, you can please visit our website at sisterlove.org and support us as you can with donations. That would be great. Use our information as well as the resources that we have. We have lots of online services as well. Even our Sentinel intervention, the Healthy Love Party, is now virtual and available online. We also want you to visit our resource guide and use our resource guide and let our partners who are listed in our resource guide know that you found them through us, because we value our relationships with our partners. And the other thing that you can do is just stay in touch. Follow us. Follow us on Instagram and Twitter. And we have a lot of young people that do a lot of TikToking. Look at our meetings, attend our meetings, support our meetings, fund our meetings. Anything that we're doing to engage with the community, that's where we need you. Time is also extremely important. If you want to write things for us, if you want to send us things that we need to post or to share, please do that as well. And lastly, join us for womennow.world, which is our biannual summit. This year we're doing regional summits virtually from all over the world, leading up to our main meeting in December 2021 to be held in Southern Africa. That news is coming to you soon at womennow.world. So that's it for me. That's my story. I'm Dázon. I'm going to stick to it with that. And y'all know, God willing and the creek do rise, I'm going to be black right here whenever you need me.